I'm Emily Walker, MedPage Today, reporting from Chicago. It was a day that some might have called impossible, or at least highly unlikely, just a few years ago. President Barack Obama speaking to the American Medical Association's House of Delegates to try and gain their support for health care reform. There are scars left over from past contentious relationships with the AMA, he told a crowd of about 500 physicians who are in Chicago for the AMA's annual meeting, which is held to decide the group's policy and to elect a new president. But those sour relationships between the AMA and those trying to enact health care reform are a thing of the past, Obama said. Dr. Michael Reichschott of New York, a delegate in the medical education section, shared his impressions of the speech with MedPage Today.
Well, I think the most important thing is that it was a straightforward speech that touched on the key issues and I think was honest in what he said. So, and he didn't say everything is going to be wonderful, and he didn't say everything was going to be easy, and he also didn't say things just to play to the needs of the crowd. You know, he said things that were likely to make some people unhappy, particularly the issue of tort reform, where he said we're not going to do it. I mean, I think that's of great concern.
Obama told the doctors that while he understands it's difficult to practice medicine while always being worried about getting sued, he doesn't support putting a monetary cap on medical malpractice lawsuits. At a press conference after the speech, outgoing AMA President Dr. Nancy Milson said Obama's opposition to a cap on liability settlements is not a surprise. The most controversial aspect of health care reform to date has been the inclusion of a public government-run plan that would compete with private plans. The AMA is currently considering a resolution to oppose inclusion of a public plan in reform. While the president said he supports a public plan, he assured the crowd that it would not turn the country into a single-payer system. That statement resonated with University of Virginia medical student and delegate Tee Nguyen.
I was really excited to see that he was able to discuss his interest in having the public option plan, but was really able to clarify that he was not moving into a single-payer system, which I think is a very important priority for the AMA and for the medical student section.
Dr. Philip Talley, a neurosurgeon from Florida, told MedPage Today that he was pleased Obama assured the docs that reform would not erode the patient-physician relationship.
His desire for patients to actually be able to see their own physician and keep the direct patient-physician relationship, I think, is a critical tenet of the American Medical Association and all physicians.
Regardless of what effect the speech has on how doctors fit into health care reform, everyone here seems to agree. Obama coming to the AMA is a sign that physicians are involved in the debate.
Oh, I think the fact that he has come to us and asked for our help, the fact that our president, both current and president-elect, have already been to the White House, the fact that the Congress is asking for our help, whether through the AMA or through the specialties. But again, everybody has to be involved with this in order to come with a general consensus of how best to achieve our ultimate goal, which is for everybody to have basic good health.
For the AMA's part, Dr. Nielsen said the AMA and Obama would continue to work together and hopefully reach a compromise. From Chicago, I'm Emily Walker, MedPage Today.